The patient process. It is important for you as a healthcare provider to not only understand the patient's needs, but also to anticipate their needs and empathize with their journey. By the time the patient gets to know you, they have already acknowledged that they have a problem and have sought the advice of their doctor to help solve that problem. So as you welcome them to the sleep lab, make sure you make them feel welcomed and comfortable. Maintain a professional, respectful, personal space for them, and let them know that you're there to help them through the night. Identification of sleep disordered breathing. This can be done by their primary care physician or by the sleep specialist. Both of them have different roles in the evaluation of the patient in regards to having a sleep test ordered. The sleep specialist does a comprehensive sleep history. This asks the patient about witness apnea, gasping and choking at night, morning headaches, nocturia, insomnia, sleep fragmentation, or having difficulty concentrating or remembering. They may perform the Epworth Sleepiness Scale or have the patient do that prior to their evaluation, as that tells them about the significance of their daytime sleepiness. They're going to evaluate the patient for secondary conditions such as hypertension, stroke, myocardial infarctions, cor pulmonale or heart failure, as well as a history of car accidents. They're going to perform a physical exam where they're looking for obesity and other features which suggest OSA. That includes a neck circumference in men which is greater than 17 inches and in women which is greater than 16 inches. That is one of the most indicative factors identifying OSA. They're going to look for an elevated BMI, which is over 30 kilograms per meter squared. They're going to look at their Mallampati score and evaluate for a score of 3 or 4, which indicates a higher risk. This is where they look in the back of the mouth and see how wide the opening is in the throat. Retrognathia is where they have a very small and receded jaw. That also increases the risk of OSA. Peritonsillar narrowing, macroglossia, that's where they have an enlarged tongue. Tonsillar hypertrophy, elongated or large uvula, and nasal polyps. The physician also uses a variety of other screening tools to help diagnose sleep apnea or other sleep disorders. The Berlin questionnaire and the Stop-Bang questionnaire are both very specific to sleep apnea. Then you have the Stanford Sleepiness Scale and the Pittsburgh Sleep Quality Index. The Stanford Sleepiness Scale tells more about sleepiness in the more recent times, whereas the Pittsburgh Sleep Quality Index actually is a very good evaluation tool for a variety of sleep disorders. It is the most comprehensive of all of them. Performing a sleep test is just like any other medical procedure. It must be done under a physician's order or referral, meaning a signature for the test must be present in the patient's chart prior to performing the test. Physicians tend to be loyal to their favorite sleep labs, and they often seek labs that are able to take a variety of patient insurances, a sleep lab that is accredited, a sleep lab that applies by the AASM guidelines, a lab that's clean and safe, and a lab that has a fast turnaround time for both in scheduling and providing the report after the study's been done. The person responsible for scheduling has a big responsibility. They must understand the setup of the lab and how the night tests run. They want to make sure they schedule the patient according to the type of sleep study that is needed. Some orders might need follow-up for clarification, and it's ideal that the scheduler does that prior to the test. They also need to schedule the patient according to the patient's sleep schedule. They want to schedule them for a time that correlates to their normal sleep schedule and not against it. They want to make sure they obtain accurate insurance information. They want to make sure they coordinate the scheduled patients with the tech staffing to make sure the correct staff is there. Educating the patient is one of the most important factors in the success of their testing and future treatment. Before testing even begins, the patient should be encouraged to seek more information on their condition. This can be through providing them with various brochures, websites, support groups, and touring the sleep lab. Once it's identified that the patient needs a sleep study, the next selection for the physician is to have the test done in their home or to have it done in a sleep lab. Sleep testing done at home is indicated for those with a high pre-test likelihood of moderate to severe OSA who do not have a comorbid condition which would put the patient at risk. Those comorbid conditions include moderate to severe pulmonary disease, neuromuscular disease, congestive heart failure, the suspicion of the presence of a comorbid sleep disorder such as hypertension, or if it's for pre-op for bariatric surgery. All of these patients need to have their sleep study done in a sleep disorders center. Educating the patient continues when they arrive at the sleep lab for testing. The first thing you're going to educate the patient on is providing them with an orientation to their room, showing them where the bathroom is, letting them know how they're going to access the bathroom during their sleep study. You're also going to educate them on the presence of the audio and video equipment, why that's needed and how it's used, basically. That they're encouraged to change in the bathroom where they're not in the line of sight from the video recording. Discuss the possible need for CPAP with a brief education on how the CPAP works to treat their condition. Explain the hookup process. You want to do this briefly on the tour, and then as you do the hookup process, you want to continue to educate the patient on why you're hooking up each piece of equipment and how it's going to help the physician treat them overall. Then explain the process of how they will get their results and how they will connect with the physician once the testing is done. Included in your education are the different options for treating sleep-disordered breathing. This isn't something you want to go into great detail on, but you want to ensure them and reassure them, that there's a variety of treatment options out there and that they and their physician will decide on a treatment that is best for them. This includes PAP devices, position retraining, dental devices, surgical procedures, and nasal expiratory resistance devices. As I mentioned earlier, treatment is determined between the patient and the physician, so if a patient returns for another study, the treatment must be ordered by the physician and you must have a new order with their signature before you can perform that procedure. The technician's interaction and education with the patient about CPAP treatment directly affects the patient's compliance and adherence. Studies show that as many as 50% of CPAP users are non-compliant after the first week of having their equipment at home due to having problems related to their CPAP equipment not being resolved or them not finding the help they need. When introducing CPAP to your patients, it's helpful to follow these recommendations. First of all, educate the patient on how the CPAP works. You want to do this before you introduce the mask and apply anything on their face. This can be as simple as you're going to feel air pressure that's going to splint the airway open to allow you to inhale and exhale comfortably. Then you're going to fit the patient with a correctly sized mask or interface device. You're going to do this with it not hooked up to the machine. This way the patient can give you good feedback on mask comfort. Then once you find the right size, you're going to allow the patient time to desensitize. This is with the machine turned on at the starting CPAP pressure. Allow them time to get comfortable with it. Allow them to hold the mask, and then you slowly add the straps. So the process of initiating therapy, again, this is just a review. You're first going to identify the need of CPAP by the presence of sleep-disordered breathing on their first night study. You're going to educate the patient on how the CPAP will improve their breathing, how splinting the airway open will eliminate obstructions and resistance and improve their breathing while they sleep. You're going to educate on how it will improve daytime sleepiness, reduce blood pressure, and reduce overall health risks. This is because they're going to breathe more effectively while they sleep. This is going to reduce their arousals during sleep, allowing them to get more consolidated and quality sleep. The patient, again, should be the one who chooses the best interface for them. A good way to test if a nasal mask is appropriate is to have them close one side of their nose and breathe through the other. If any obstructions are present, then a nasal mask may not be the best device for them. A full face mask may be more appropriate. Then the patient needs to have time to desensitize with the equipment or habituate. You always start by letting the patient hold the mask over their face with the pressure on. It's important to have the mask pressurized while they do this so you can make sure you're getting a good fit. Then you want to put the straps on, let them have it on for a while prior to turning the lights out. Let them watch TV or read for a short while. Let them lay down for it with it on. They're going to have different leaks popping up, so giving them time to adjust the mask themselves is important to making them feel comfortable with the process. There's a variety of different interfaces out there to try, so make sure that you offer what's available with your sleep center. Most patients assume that once their sleep study's done that you're going to give them a machine to go home with. You may need to make sure that they're educated and know the process after the sleep study is over. Typically, you need to have them get their equipment from a durable medical equipment called a DME company. Your lab will contact the DME of their choice with the information they need to set the patient up with their equipment. Ideally, your sleep center should make an appointment with the DME for the patient just to streamline the process. The DME company will contact the patient directly about the CPAP equipment if you don't set it up for them. The patient follow-up process is one of the most overlooked but most important pieces of the overall treatment. Your medical director will often direct you as far as the follow-up process and protocols, but each patient follow-up needs to include education, positive reinforcement, follow-up within the first few nights of having their CPAP equipment at home, and then problem solving. All of these have been shown to improve compliance and adherence. Many sleep labs perform a follow-up call. Some important things for you to check on when you make these calls is, did the patient receive their results from their doctor? Has the patient's overall experience, how was it in the lab? Was the CPAP equipment received from the DME company? And did the DME company explain the equipment and give the patient information on where to call if there's a problem? If any of these have not been resolved, it's your job to help resolve them for the patient.